This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everybody. She is somebody that helps people of all ages improve their communication. We're talking about speech and also hearing to some degree as well. We're going to focus on children today and some of the challenges that kids have of all different ages, what presents as well, and even as a parent, what you should be looking for. She's the woman behind Cape and Speech Therapy. Cathy Salciccia joins us on the program. How are you doing today?
I'm fine. How are you?
Very well. And this certainly is one of those things that rings concern with any parent when they have a small child or even even a baby, where they're wondering if their child is developing as they should when it comes to speech and also when it comes to hearing. Where should we start today?
Well, I think we can start in the statistics because I think the statistics are very meaningful. National Institute of Health in July of 2025 basically identified that 1 in 14, which is about 7.2% of US children between the ages of 3 and 17, have some sort of communication-related voice, speech, or language disorder. The highest prevalence is in children between the ages of 3 and 6, about 11%, and as compared to 9.3% in ages 7 to 19. And it's a very important issue, and it's something that I think is important to be identified early. The parent's first line of defense is the pediatrician. They go to their pediatricians and, is my child developing normally in terms of speech and language? And the pediatrician is really able to give them good guidance, very good guidance. However, you may have a parent where this is their first child and they don't know what to expect. They may have had 2 or 3 children before. And so they have some sense as to what to expect. Or they may have had girls, they may have had daughters, and now there's a son, and maybe he's a little bit slower and his production, so they don't really know. Now, sometimes, what the pediatrician will do is they'll say they're within normal limits. I'm not too worried about it right now, and they'll ease the parents' concerns. Other times, they might, it'll get to a point where maybe the child is past the age where certain sounds or certain language symptoms should be, language presentations should be in. And then at that point, they may suggest the child goes to, to a speech pathologist. Now, if we're talking about a child that's really identified early, let's say, 0, 1, age 1, age 2, then they may refer them into an early intervention program where the children can get early intervention. And in that case, the speech they'll be evaluated by a speech pathologist or an early childhood educator who will come to their home and work with the parent and work with the children in their house. But there are parents I have found who, for whatever reason, decided that they want to go to a speech pathologist as opposed to go to an early intervention specialist, and so they can do that too.
Is there a certain age where, and every child is different, every situation is different, where you really need to make some decisions at that point?
Well, I think so. I mean, well, first of all, you have to understand that there are different forms of communication impairment. So I want to back up a little bit. There are disorders of oral speech production. That's articulation. There are disorders of phonology, meaning the rules of the speech sounds, not necessarily related to a child's ability to produce sound, but to understand and abide by the rules of speech sounds. Then there is the production of words, vocabulary, any vocabulary. What are they saying? How many words Are they actually producing? Um, um, and are they intelligible when they do it, right? And so I would be concerned really between 2.5, 3.5, somewhere in that area, and always understanding that there is a range. So, for example, there are developmental tables that all parents now can find right on the internet. This wasn't always available to parents years ago, where they could just go and find what the norms are. And so I encourage families when they have children or new children, go and get those norms and start watching your kids, and then
Hmm.
see if they're within those norms. And what I mean by that is, all because a child hasn't mastered a sound at a particular age level when you would expect that sound to be in, it doesn't mean to say it's not going to come in. It could potentially come in, at the later end of that range. So, but I think behavior has is relevant, because we have more children that are in daycare centers. They're in preschools. They're being watched under the watchful eye of daycare center teachers and preschool teachers. And what they may see is just that the child's communication is it's compromised to the point where other children are not understanding them, or they're having problems with interaction with other kids. And then they will start to experience frustration or isolation. So that's one piece. The other piece is, when it comes to language development, you can't ignore the impact of play, a child's level of play, because play is actually one of the roots of language development. And so, what parents can do is watch how their child is playing. Are they picking up trucks and,
Hmm.
moving trucks back and forth? And are they using them symbolically to go up a ramp or down a ramp, that kind of thing? Or are they just taking trucks and piling them up like this? Just piling them up, what we call nesting behavior. They put them on, they take them down, they put them on, but they're not developing a symbolic use of those toys. So pathologists are trained to look at the broad spectrum of cognition, play, speech development, language development, all the way to the point where they're supposed to be developing discourse. Um, and most certainly, you want to get it earlier rather than later, because a child's phonology development and language development will impact their ability to learn to read later on. So it's a prerequisite for literacy.
Cathy, what is in your experience, has been the ratio between speech challenges and hearing? So a parent may think, oh, my child has problems verbalizing, but maybe they have a hearing issue. Of course, that needs to be identified.
Mhm.
How often is it a hearing issue?
Well, it can be a hearing issue, and especially if you have children who have a history of middle ear infections.
Hmm.
Middle ear infections are common in children, and they're a leading cause of language delay.
Wow.
And it's because they develop what's called a conductive hearing loss, where they have a buildup of fluid in the middle ear. And when that happens, sound is going to sound muffled, inaudible to them. They will have trouble perceiving. You'll even see that they may have trouble alerting when their name is called. Okay. Later on, what you'll start to see is they may have difficulty uh, producing certain speech sounds, or including sounds at the ends of their words because they didn't hear them. right? And so I think that that's really important. Sometimes they have a eustachian tube dysfunction, or a malformation. So I think that the issue around hearing is important. And so when you have a child who's having problems with speech development, I mean, at least what I do is I usually refer the person to take their child to a hearing center. Usually they're hospital based. These are specialists, these are pediatric audiologists who are specialists in being able to tease out. And even if the child has, some difficulty responding, they're very, very good at teaching them through trials as to how to respond to sound and sound field. And they may even put probes in their ears and be able to test out if there is an increase in liquid or fluid in their middle ear. And if that's the case, then these children can, they can be treated. Many of them go on antibiotics. Some of them will have to have tubes put in their ears, and so it's really important to identify if your child is having these types of problems. And sometimes the child will cry, they'll have pain, they'll be tugging on their earlobe, signaling. And so these are the kinds of things that parents can look for. And hopefully, once it's remediated, then they will start to get acquisition. Sometimes they will need a little speech therapy to sort of catch up if they're having delays related to that.
I can't imagine as an adult if we had an inner ear issue, that underwater sound where everything is muffled. That drives you crazy. Imagine being a kid and you can't process things, you can't understand things.
Mm-hmm.
What would you say are the top 3 challenges for children with speech issues? You mentioned a few, leading up to this, but what would you say in order, in your experience, from top to bottom, they are?
Top 3 challenges of kids with speech issues or language issues, or both, or the combination?
Either, yeah, either one.
Either. Okay. Because I separate them out because they each have their challenges. Children who have, well, let me go back. Children who have articulation issues may just have difficulty producing the sounds. But that in and of itself can make things very difficult for them because they're not being understood, right? Perhaps by anyone else other than their parent. And I want to give an example. The first child that I ever worked with, when I was an undergraduate in the hearing clinic at Douglas College, came because she had absolutely no consonants in her speech. So, our vowels are A, E, I, O, U. Every other letter of the alphabet is a consonant sound. So everything sounded like this. O, right? Now her mother understood that meant I want a cookie, right? But outside of the home, no one understood her. Okay. So you have the issues around being with other children and not being understood, not being able to get their needs met, right? And then you have the additional issue of whether or not there are any compounding things that are going on. A child that may be showing signs of ADHD, attention deficit issues, impulsivity types of problems. But even if they aren't, there's extreme frustration because they want to communicate. They want things, right? And so you can start to get behavioral problems, frustration, tantruming behavior, all kinds of behaviors that if you track it back, you really want to look at their communication, because communication is so important that if a child or even an older child or with a language problem isn't communicating well enough, they will resort to other methods and behaviors. And so when you say what are the major problems, those are problems socially, and right, That's one issue. And then the other issue is not being able to move forward in academics. When we develop the ability to decode words, up to about third grade. And around third grade is when we read to learn. So we learn to read, and then we read to learn. And so if there's a speech and language problem that has not been addressed, and this is going to impact the prerequisites for learning to read, then the consequences are far reaching in terms of their academic acquisition, and it will impact them across the board, because language comprehension, verbal expression, reading, sound, it's all part of the academic process.
Mm. I can't imagine that situation where you have a child that feels that they're not being heard, and then what could ensue after that? Frustration, acting out. That it might be perceived that, the child is being defiant, even as, a 3-year-old,
Mm-hmm.
but they're not being
Well,
understood.
well, that's exactly right. And not only that, they might say, oh, he's just being a 3-year-old, or
Right.
he's just, you know what I mean? They may attribute it to that. And there may be a piece of that in there. But what it might also be is a child who is getting well, they're displaying emotional and I'm going to use the word dysregulation as a result of the fact that they're not able to communicate well enough. Then, what might even happen is they might get older and, develop some language, and they're sort of functioning with it, people think is fairly well in school. But then there are all these other resistive behaviors that are going on. And sometimes it's not being fully identified that there are language-based learning disabilities that are there, and they need to be evaluated. So my position is that if you think that there is a speech and language problem, or that they're not acquiring it, go get an evaluation. Get an evaluation. Now, parents can request evaluations in their school. Um, um, they write a letter to their special education director or coordinator or to their teacher, say, I am concerned, I would like my child evaluated.
Are
And
they in school, those evaluations, are they effective in your opinion
yes,
overall?
yes,
Okay.
yes. Well, let me put it this way. Um, my field is loaded with, I think, some of the brightest, astute, well-educated individuals.
Wow.
And I mean, I mean this sincerely. We are all over the country, and we are all over the world. Uh, in terms of communication specialists, they may be called something a little bit different in another country. What will happen is, when a student goes to graduate school and becomes a speech pathologist, um, some will want to specialize in pediatrics, and many of those will go right into the school system. Um, uh, Others may go into hospital clinics that specialize with, pediatrics. Some may go to, because they want to work with kids with cleft palates, where the palate didn't develop well enough. But those individuals have an opportunity to see many, many, many children, right? And so they have the training, they have, and depending upon the age, there are various tests, standardized tests that are given to the child to tease out their articulation profile, their phonological profile, and I differentiate that a little bit and I can talk a little bit about what can make an articulation problem different. Their language levels, and they can create a pretty decent profile of a child who is having a speech or language problem and make recommendations. If they think that the child is in a general range, they will say so. But if they think that this is something that really needs to be worked on, yes, they are very, very capable of doing it. Now, of course, one of the issues in school settings is that these speech pathologists have big caseloads. They have big caseloads. And so, they may need to group, a child with another child, or put them in a small group and address their goals that way. But yes, I think that they can be very, very effective. Where I find sometimes it's not as effective is with a child who may be maybe second or third grade. And this is the child who you have to pull answers out of them. You ask questions, they're not readily answering. They answer in very short words and brief phrases. You're not getting a lot out of them. Parent asks, what happened in school today? They give you very little information, and that's it. And I bring this up because the standardized tests that are typically given to evaluate speech and language issues may not necessarily be sensitive enough to tease out what we call a narrative language problem. That's a little bit different. So for example, you show a child a picture and you say, tell me about this picture. Tell me what's going on, right? And you might just get a very cursory, description. I see a chair, a kitchen table, whatever, right? But they're not able to create a story or a narrative about that picture, right? That's different. They may have trouble with the words, right? Or they may be having trouble putting the grammar together to express that description. Or they may be having trouble with organizing the information in order to put out a description.
But that doesn't necessarily mean that they have speech issues. It's just the way they form sentences.
It's a little bit different than that. And again, I want to separate out speech issues from language issues. So I want to backtrack. I want to backtrack. When I think of speech, I think of a child's or a young, a school-age child's ability to create the sounds, right? Literally with their mouths. And there may be reasons for that. That may be neurodevelopmental. All right. And I don't want to get too far afield. I'll address that in a second. But then you have children who have phonological problems. Those are the features of the sound. So I want to give an example. The letters P and B, P and B, right? They're pronounced with stopping the air and exploding the air. We call them stop plosives. Those are features of those sounds, and they may not have mastered those features. Okay, that's one issue. Then there is the issue of vocabulary and semantic development. That's based upon our world knowledge. So the more exposure a child has, hopefully the more words and vocabulary they will develop. Then there is the grammar that we use to put those words together to create thoughts. And we may change some of the words. So a word like walking means you're walking right now. But a word like walked with the ED at the end means you have already walked. And so you can change meaning by adding on little elements to those words. So there's the grammatical piece. And then there is the narrative piece, right? And that's where you are putting it all together in an organized way to express thought And in many ways, it's the intersection of cognition and language. It's the
We're just
intersection.
about out of time.
Mhm.
What insight do you provide? Um, I said this before we got on here, but I'm going to say it again. Your ability to hear these certain things, your hearing in general, but what comes from anybody that you evaluate, it's amazing. Like even these little finite details. Um,
Right,
and also
right.
encouraging to know that the tests given in schools are better than many parents might think. We might, think we have to go to a professional, get them out of there. But no, it's encouraging to learn that. How do we connect with you, Cathy? Cathy, what's the best way?
You can connect with me through my website, which is capeandspeechtherapy.com, or through my office number, 978-282-8210, and that's in Gloucester, Massachusetts.
Can you support somebody who's not in that area virtually at all?
Yes, yes, I can do that,
Beautiful.
but I have to be licensed in that state.
Gotcha.
So in other words, we are required to have, like, if I wanted to treat someone in Florida, I have to have that license.
Thank you for all the insight today. Eye opener. It really has been.
Yeah,
Yeah, for parents and even if you're an adult, just to learn the process. This is the most important thing, communication. And it doesn't matter whether, we go to digital and AI and all of that. It starts with the word, the spoken word. And
yep.
I
It
appreciate
starts
it.
with this. It starts with the spoken word, and your ability to communicate will influence your level of success in the future. And it's very, very critical. It's one of the most critical to me because it's what separates us out as human beings. It's our communication.
It's so true. Thank you. We'll talk soon, okay?
Take care. See you
Appreciate
next
it.
time. Bye.
We'll be right back.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.